Alrighty. Hello, everyone, and welcome to the American Canadian School of Medicine's webinar on practicing medicine in Canada, your pathway back home, and how ACSOM will get you there. I'm just going to give a moment for folks to jump on the webinar, just get everyone settled. But I'll introduce myself briefly. My name is Christine. I'll be your host for this evening, and I'm joined by my colleague Sandra Banner, and we'll get into formal introductions a little bit later. But for the folks that are here, if you wouldn't mind putting in the chat where you're from, what year you're thinking about starting your medical education, maybe a fun fact. I'll start since it's with my kind of Canadian cohort here. I tell folks outside of Canada that I'm located in Toronto, but I'm actually in the city of Peterborough, and it's a beautiful evening. It's starting to feel like summer, so I'm very, very happy about that. And I'd love to hear where all of you are coming from tonight. And I'll let Sandra kind of give a brief introduction of herself.
Hello, Sandra Banner. I'm working with the School of Medicine in recruitment and strategizing. In another life, I was the CEO of the CARMS Match for many years, and I'm hoping tonight to give you some really clear information about what the pathway home might look like. I am sitting on a farm in the Ottawa Valley, and it is a gorgeous evening. It's so nice I even opened my pool.
Oh, wow. That is a good moment for summer if I've ever heard. Okay, well, I guess we'll get started just so that you folks can learn a little bit more about ACSOM and your pathway back to Canada. I'll introduce our speakers for this evening. So my name's Christine. My face is covering my name on the screen, but my name's Christine, and I am the enrollment coordinator here at ACSOM. So I help folks through the entire process of applying to ACSOM, moving through with their transcripts, their prerequisites, getting all the documents they need, moving you through the pipeline to your interview, and hopefully accepting your offer and seeing you on island in Dominica. We will also be joined by Dr. Arvind Bagapour, who is our founder and board chair, and he is a really great insight into Caribbean medical school and understanding the landscape of being a physician and what you're about to step into. And then Sandra introduced herself, but she's formally with us as the Director of Canadian Operations and has a wealth of experience in the Canadian residency matching system and just understanding how IMGs and Canadians who study abroad can come back home. So we will get started. Just before I get started, I do want to mention that you can drop your questions, your comments, your concerns, anything in the chat at any time, and we can answer those kind of as we go along. I hate to feel like we are just talking at you, so we want this to be interactive. And if you have any questions, please feel free to put them in the chat, and we will address them both in the chat, and then also we can say them out loud for the group. Sometimes you might think that your question is silly, but it might be the exact same question that 4, 5, 6 other students have. So please feel free to drop those in the comment section. So I want to get in a little bit about the ACSOM advantage and why we really believe that we stand out amongst the international medical schools. First of all, this is the stunning location that you will be studying at. This is the island of Dominica where we are located, and this is just a beautiful aerial view. You know, on a day like today, you might not think that there's an advantage to studying in the Caribbean, but when it is the depths of winter, there is no place I'd rather be than in a beautiful agricultural island that works to restore their natural ecology and offers just a beautiful landscape and a picturesque background to your medical education. But that's not the only advantage. We offer small class sizes of 10 students. They're capped at 10, and you're always led by a physician tutor. And this offers personalized learning. And this is very unique to ACSOM. You know, you might see on TikTok or Instagram that there are videos going around of Caribbean medical schools where you're in a lecture of 300-400 other students. That will not be the case at ACSOM. You will have small classroom learning, case-based learning, and the opportunity to be mentored by the physicians that are leading your class, not just a PhD in anatomy or physiology, but really a physician who understands how things work together, how your organs and your systems work together with anatomy, physiology, histology, pathology, to really create a holistic understanding. And all of this will be applied in a small group setting. So you can really get your questions answered, work closely with your team. And that is really unique to ACSOM. We also have state-of-the-art facilities on a beautiful campus that will enhance your experience. So this is our campus. You know, it's a 1,600 square foot campus. We have beautiful facilities for our students to study at, to make sure that you are getting a state-of-the-art experience. And to the curriculum side, your day will start with kind of a guest lecture of an expert in that field. So if you are studying the reproductive system, we just had Dr. Upadhyaya from the University of Calgary join, and she has a PhD in midwifery, and she was your guest lecturer for the length of the module. And then you would break out into your small group learning and chat about the content and work through the case that you were given the night before. And then you'd spend your time in the afternoon in our labs and doing more hands-on learning. And this is the facility that you would be doing it at. It's located on the waterfront, ocean, so you get some beautiful ocean air. And if you ever get some time, kind of some downtime in between your classes and your studying, it's a beautiful place to kind of take in some of the natural beauty, see what the island has to offer, and you know, get to know some of the locals. Our curriculum is a modern North American curriculum, which is not dissimilar to what you might see at McMaster University or McGill University here in Canada. These are actual photos of our students that are engaging in their course-based, case-based studies. So this is one of our students, Patrick, who is actually assessing a patient in real time. And this is another one of our students who is performing an abdomen assessment on a patient. So these are the opportunities that you'll get to really take what you've learned from your guest lectures and your cases and apply them into real world settings. We also give you early clinical exposure and research opportunities built into the curriculum because we have a hospital on the island, and because you're being taught by physicians, you will get the opportunity to get that early clinical integration in your first and second year within the medical curriculum. We are also the only non-for-profit, sorry, Sandra, I'm just going to remove you from the screen so we can see a little bit more of the text. As the only nonprofit, we also focus on social, global, and Indigenous programming. So we're very proud to be the only non-for-profit medical school in the Caribbean. This means that we can focus more on offering our students a state-of-the-art education instead of really just looking to profit off of our students and fill our classrooms with folks that want to be physicians but aren't necessarily always prepared to be physicians. So we focus on social and global programming, and we work with the Indigenous folks on the island and work with them through public and global health so that we can understand the social determinants of health and the cell to society approach, which is also very important when you're coming back to Canada and working with our Indigenous populations here in Canada, as well as even just understanding how being in a rural community might need different healthcare than being in an urban city center. So this is a photo of our students that were giving diabetes education to folks on the island, and really telling them about warning signs or when to get tested or why to get tested, the importance of understanding a little bit more about their health so that they can take some preventative measures. So that is also something that is built into the curriculum. We have our World Health Day where we do more work with the local folks on the island, and we bring in students from the island to learn more about medical school and science, and maybe they can see themselves pursuing a career in health as well. You will be provided with expert educators that will give you mentorship and support, and they will support your success. So in this photo we have, this was also from World Health Day, In this photo, we have Dr. Loy Wiley, who is a wonderful professor out of Western University, and she teaches our public health module, and she works with our students to explore some of that public health that we do with the Indigenous folks on the island. And that's just one example of the mentorship. Because you're taught day in and day out by the same physicians in your modules, you have that ability to make those relationships with your with the physicians that teach you, and get reference letters that will go a long way when you do your clerkships and your residency. So they're able to cater their references to you and who you are as a student, because they worked with you in that small group setting and they got to know you very well. There is a really close knit between the students, the cohort, and the folks that work at ACSOM. And they have barbecues together. ACSOM takes their students and on Saturdays to the farmers market in town with a bus. So there really is a nice relationship between the students and the faculty and the dean of academics and the dean of the support services, and really creates a really beautiful community for you when you're studying in medical school. So those are a little bit about the advantages of studying at ACSOM, but you might be wondering what life at ACSOM is really like. What's it like to be kind of a medical student away from home in the Caribbean, in Dominica, on a different island? And it's beautiful. As I mentioned, the students have a really great relationship with each other, with the members of the community, and with the folks that work at ACSOM. And this photo of our students smiling was at the meet and greet day. So this was the first time our students were kind of getting to know each other in their orientation beforehand. And then we have a photo from Creole Day on campus, where folks got to learn a little bit more about a different culture and experience really delicious food and dress up in beautiful garments. So it's not just studying all the time. There is a really nice community, and there are clubs that students can be a part of. So we have an active student government. A Canadian student is actually the class president, which is awesome. Daniel, he is a really great person to talk to if you ever need advice. And it's just outside of obviously your medical education, there is a great bond between classmates, and there are clubs and associations to be a part of. There are ways to get research. There are things to do on the weekend. So as I mentioned, there's the farmers market. You can try out local restaurants. You can, we've organized, in the next slide, you'll see we organized a volleyball tournament, and it was a wonderful kind of friendly competition amongst ACSOM students and some, I believe, the local high school, and they were playing against each other. I think the ACSOM students lost, unfortunately, but it was a great day of school spirit, and a great way just to kind of blow off some steam after classes and when you're not studying. And then these are actually photos that our students and faculty took when they went whale watching. So this is just another really great way to see what you can do when you are not in your studies. So you might be wondering, I learned a little bit more about ACSOM, and I got to know a bit more about the curriculum and what life as a student is going to be like, but am I competitive? This is a question we often find students ask themselves. And because the Canadian landscape is so competitive, sometimes students self-reject. They think that they're not competitive because of they know what their friends have who haven't gotten into medical school, or you're just so used to being high achieving students that you're not sure where you're going to fit. But our admissions process really takes a holistic approach. We don't look at your individual scores and your MCAT and your GPA. We really look at the holistic, who you are as a person, instead of the sum of your parts. So we consider a wide range of factors to evaluate your overall potential and your strengths and what you would bring to our program and how you would be a great physician. That being said, there are still some minimum requirements, and I'll run through kind of what the admissions process is like. So first things first, you submit your application, and we are still accepting applications for our 2025 intake. Classes begin July 21st. So you still have time to kind of get your application in, get your transcripts to me. I assess the applications, and then we can move you through to an interview phase. So you submit your application, you book your admissions interview, you await your decision, and then you prepare for life on the island. So if you are interested in kind of maybe you heard back from some of your Canadian schools that you were thinking of attending and your plans have since changed, we are still accepting applications, and I would love to chat further, or if you have any questions about that, you can put that in the chat, but it's not too late to decide that you want to go to medical school. So some of the things like what we look for on our application are our prerequisite courses. So you, to apply, you need to have these prerequisites: 2 semesters of biology, 2 semesters of chemistry, 1 semester of organic chemistry, 1 semester of physics, and 1 semester of math. So we look at your overall GPA and your prerequisite GPA, which is inclusive of these courses. If you don't have physics and maybe you're at the end of your degree and you're panicking, physics is one class that we can find an equivalency for, but the other ones are kind of non-negotiables for us, especially chemistry. That's a great predictor of success in medical school. So when you apply, if you are applying using your AMCAS, maybe you've already applied to Ontario medical schools and you have your OMSAS, we will need an additional resume and for you to submit the application. And then we also ask for your MCAT score. And then if you are just submitting our general application with your transcripts, we'll need a copy of your transcripts. They don't have to be official at this point. They can be unofficial. I know finals just ended and you might be waiting to hear back on some of your grades. You can submit an unofficial copy of your coursework, and then I can assess you from that, as well as a resume, your MCAT result, and a personal statement. Now, you might be wondering, when you attend medical school, will you be left kind of to your own devices, or will you be forgotten about because you've seen kind of large lecture halls, or it's a professional program? You might be thinking that there isn't the same level of support that you might have gotten in your undergraduate studies. And I am here to tell you that you will absolutely get the support that you need to be successful. Firstly, with myself, I help you through the entire application process. As I mentioned, I help students, even get to the point where, we look and we see, oh, flights are the cheapest. We've seen them in a really long time. You might want to book your flight now. I help students connect with other students. I help with the application. I help get your transcripts. I help schedule your interview. So basically the entire process before you start your medical education, I will help with. We also have a robust student support services team, and they are wonderful. And they help you with things from housing to booking your flight to everything you might need when you're on the island. So, so they help you with all of everything that you need in that way. So you can do virtual showings of your housing. We also have kind of academic supports when you're on the island. So we have folks that will help you with your, if you need learning accommodations, if you need tutoring, if you need support, maybe you hurt yourself and you need a kind of accessibility accommodations. We will help you with all of that when you're on the island, which is really great. There really isn't something that might arise for you. We have mental health supports. We have physical supports on campus. So really you will be holistically supported for anything you might need when you are in your education. We also have our financial aid department that will help you kind of understand how you're going to pay for your medical school. So they help you with your scholarships, which are given at the time of acceptance. They help you with loans, with the professional lines of credit. They do a lot of financial aid counseling, and they're really the first people that we recommend you meet with when you get your letter of acceptance, because they are a really great resource for you to understand kind of the next steps and how you're going to pay for your education, but also if you are getting a loan, how you're going to repay that loan. So they help you through from admission all the way till repayment, which I think is a really great team to have on your side. And they are very transparent with our students. They want to make sure that you fully understand the process, so that I know that for myself alone, when I was going through my master's, felt a little daunting. I didn't fully understand it, But that's what our financial aid department is here for, is to help support you through those unknowns. And finally, the biggest question that we get is, will I be able to practice in Canada? And what does the pathway home look like for Canadian students who study abroad? And for that, I will pass it over to my colleague, who is much more experienced on this topic than myself. So I will hand it over to Sandra.
Thank you, Christine. It's great to be able to meet with you tonight. I hope there are some students who are at that point where they can look at the offerings of ASCOM and compare them to other schools. I have been working with ASCOM now for 2 years. My colleague and a director of the board is Dr. Andrew Padmos, who was the CEO of the Royal College of Physicians and Surgeons of Canada, and he was the incoming dean of Toronto Metropolitan University. Both of us have lent our support to the school because we believe in it. We believe in this very modern, up-to-date curriculum. We support it because it's a not-for-profit school, so that the resources are reapplied to the school and to ensuring that your education is as up to date and appropriate to the North American model. Another support aspect of the school is that I will support you for your pathway to residency, not just now, but at any time in your journey. You can always call on me, and I will also make efforts to keep you up to date as a student body with any changes in policies. It's a fairly complex field. And because Canada has experienced and recognized, I will say recognized, such an enormous shortfall in health human resources, particularly physicians, as well as other health human resources, there is an opening of closed minds, will I say, in the last year or two when it became a crisis in Canada. Now, there is no doubt that a decade ago, a Canadian student who was considering going abroad may have had some reason to be a little anxious about whether there would be an opportunity to come home to practice. There were a few barriers in the way, and I have to tell you that most of those have been eliminated. Not entirely. We will still assess you as a student. That's part of the process of the licensing authority. You need to be assessed. But the reality is we know how much we need Canadians who studied abroad to come home to Canada. So there have been many policy shifts to make that happen. In Ontario, and actually in some of the other provinces, one of the shifts are that unmatched positions, while the match is running, if the Canadian, as you know, or you may know, some programs are designated just for Canadian students. Let's say a quota in anesthesia might be designated just for Canadian students at this particular university. But if during the running of the match, there's a vacancy and nobody filled it, that position can now go to the IMG program. So that there's, this was always available to the programs, but they never took advantage of it. And the result is that in 2025, the match that just ran, we had almost 900 international medical grads matched. Now, compare that to a year or two ago when we were lucky to hit 400. This is a dramatic shift, and it's obvious that there's been a dramatic shift because provincial governments have changed. There's been some CARMS changes. There's been changes at the medical licensing authorities. So the CARMS change that I think is the most important one is that the match is now being run before the NRMP is run in Canada. In the US, I apologize. For the last several years, the CARMS match came second. Now, what does that mean for you as a Canadian studying abroad? Everything. Because you can actually apply to both matches, the one in Canada and the one in the US. And it's obvious that the US is much, much bigger than Canada. And if perhaps your particular career path has not very many positions being offered in the Canadian match, you may want to try for those because that's your first choice. So you rank all the programs that you want to be matched in Canada. And if you are still unmatched, your name will automatically appear in the US match, which you also have been exploring. And if you've submitted a rank order list in the US match, that then takes over and you are then able to be matched in the US. So having our match run first means, as a Canadian, we believe and we hope that being matched in Canada would be your very first choice. And by the matches being run in that order, that gives you the most possible opportunities. You can apply to the first iteration of the match, and if you don't match, your list in the US stands. You apply and are run through that rank order list in the US. If you don't match, then you can then come back to the second iteration in CARMS and apply again. So they've opened it up so that there's every opportunity as a student to be matched first and foremost, we hope, in Canada. And if not, you have the whole of the US as an option. So that's one of the major changes this year in CARMS. There has been, as I told you, a few match policies that actually come from the schools themselves, where the quota is transferred over to IMG quota. So it's increased the number of internationals who match this year dramatically. And just as a FYI, 82% of the Canadians studying abroad this year, if they were graduating in 2025, 82% of those that went through the match matched. Now, that's almost equivalent to what the first round of the CARMS match is for any medical school. In addition to that, those who were unmatched last year or took a year off and came back into the match, again, Canadians studying abroad, 72% of them also matched. So just the match results themselves can show you that they've opened the doors. They recognize that you are a resource to our dire physician shortage, and you are being welcome home. Now, there are steps. There are steps on the way to every part of your career as a physician. And there are exams, but that's not going to be unique for now either, because there will be exams throughout your entire career as a physician. So in medical school, in our medical school, you will write your step one, which is a US exam, licensing exam, and it's part of your certificate, well, part of your MD degree. You will also do step two, which is also a US exam. And while you're studying for step two, in effect, you are studying for the Medical Council of Canada evaluating exam, which is the same exam that every Canadian student who studies in Canada will take. So you will be taking the equivalent exam as all the other Canadian students studying at McGill or Toronto or wherever. And once you have passed that, there's one other step, and that is our OSCE. It's a clinical exam, and you will take that. This allows you to go into the match. The other aspect that allows you to go into the match, of course, is we are a fully accredited medical school. So that, which means you are an equivalent, we are equivalent to any medical school, whether it's in Ireland or Australia or other Caribbean medical schools. We are equivalent in our accreditation status, which is what allows you as a student to go further and take the exams that will allow you to be matched into North America. So the pathway is, of course, your first 2 years are on Dominica. Your third year is when you move into basically hospital-based clerkship training. It's your core, all your core rotations are taken in that third year. We have hospital partnerships in the US, and we also are working on and very close to signing hospital partnerships in Canada, which means we would actually be the only international medical school in the world where a Canadian could study, where you have the opportunity to do your core clerkship training back in Canada. Now, that hasn't been finalized yet, but we have every expectation of this. The contracts are out being reviewed by lawyers, et cetera, et cetera. And in effect, this will be in place, we hope, very soon. So as a Canadian student, you would be two years in Dominica, and then very likely you will be able to come back to Canada to do your third year, which of course will allow you to build a network in the Canadian clinical setting, which helps you to choose your where you want to do your residency, what career pathway you want to follow, to get to know the people who can influence that career choice, mentors in your career choice. All of those things will be a lot more available to you in the Canadian context if you're able to do your clerkship in Canada. So we're very, very excited about that possibility, and also incredibly optimistic. So during your end of your third year is when you take the Medical Council of Canada evaluating exam. It's actually the beginning of your final year. You take that exam, you then also take your clinical assessment exam, and you go through the match that year. You go through both matches at the same time at the beginning of your final year. Just to let you know, because I work with ACSOM, I will also be available to you as students as you navigate this pathway. I will make sure to ensure that the faculty at ACSOM are fully aware of any changes in the Canadian system, and I'll deal directly with you as students as well. One of the things I will say is you can begin your journey as soon as you are admitted into medical school. You can begin your journey home. You register with the Medical Council. You think about where you would like to practice, and you get in touch with recruiters who can eventually work with you, starting even in second year, to ensure that your career pathway will lead you to practice in communities that you may be interested in. So it isn't something you wait to the end of your cycle to do. And there's many, many people who can advise you and assist you all the way along that journey. And we will keep all of those people up to date so that you have accurate information, no missteps, you meet all your milestones, and you move into residency training, I hope, in Canada, because I can tell you right now, we need you to come home. In the past, we know that about 90% of the students who studied abroad did not come home. They stayed in the US. I can tell you that that wasn't because they couldn't. It's because so many of them began to build a network in the US where they were doing their clerkship. That's why we feel it's so important to bring you home as early as we can, so you can build that network and that career path home in Canada. And we have every expectation that we will be able to deliver on that. I am available at any time for any questions you might have. As I said, there's never been a better time as a Canadian student to make the decision to have an international medical education, because many of the barriers, most of them attitudinal, have evaporated, and people are much more aware of the strength of these students that have studied abroad, their resilience, their determination, and they are welcoming you home in much greater numbers than ever before. 82%. That's something to be very proud of. Anyway, I want to make myself available to you. Christine can put my email up on the chat if you have any additional questions, but I'm happy to take questions tonight in the chat here.
I was muted. My apologies.
That's what it was.
It always happens. Doing this for a long time, and I always mute myself. Feel free to put any questions that you might have in the chat, and they don't need to be ACSOM specific. They can be about being a Canadian who studies abroad, any concerns that you might have, or anything about the pathway back home. Sandra is a great resource, and I'll make sure to put her link or her contact information in the chat. But it's not a small decision to make the decision to go to medical school. So there's no question that is too big or too small, and you can't meet with us enough. You can't. We've had students that made the decision to come to ACSOM after chatting with myself, with Sandra, with the Dean of Academics, with a current student. So it is a large decision that should be treated that way. So don't feel like you're bothering, or that you can find this information on your own. This is what we're here for. So please feel free to put your questions in the chat. And Dr. Bagapur will be joining us in just one moment, and he will give a great kind of more of a holistic overview of ACSOM and pick up some of the points that I missed. And there he is right now, and I'll add him to the stage.
Hi, everybody. Sorry for being a little late. I just finished up with clinic today. I was seeing patients, so I got on, not at the beginning, but more at the end. I appreciate everybody for joining. My name is Dr. Arvind Bagarpour. I am a vascular and interventional radiologist. I put stents into people. I stop internal bleeding. I treat cancer. I do all the biopsies in the hospital. When people's lungs collapse, I take tubes in them called thoracostomy tubes. I take clots out of people's brains that have strokes, out of their lungs that have pulmonary embolisms. But I also read diagnostic imaging, so I specialize in making diagnoses and using the technology to subsequently treat patients. And this all started because I chose to take the route of going to a Caribbean medical school. In fact, the Caribbean medical schools aren't really an alternative. They're a integral part of the U.S. healthcare system. 20% of all the doctors that practice in primary care, thousands and thousands and thousands of them, are from the Caribbean medical schools. And when I mention primary care, it's more in the U.S. Scope includes internal medicine, family medicine, OBGYN, psychiatry, and pediatrics. So quite a lot of doctors. And this pathway has been around for a long time. So today I'm just going to really talk to you about 4 things. And these are 4 things that I always think about when I talk to med students. And I've had this really unique opportunity, and I'll tell you how I've gone through it and how hundreds of thousands of other doctors have gone the same pathway, because I went to a Caribbean med school. Number one, we're going to talk about what is the pathway of going back to Canada and the U.S. as a Caribbean graduate, or coming from North America or U.S. and Canada, and then going back to for 2 years away into the Caribbean and doing your clinicals back at your home country. The second is how is ACSOM uniquely different than all the other Caribbean schools, but just like the schools in Canada, they have great curriculums and the best schools in the United States. Number 3, talk about what it takes to get a residency program, how that looks, and number 4, finances. So I'm just going to do this kind of quickly because I don't want to take too much of your time. But the first thing is, the Caribbean pathway has been around for a long time, since the 1970s, well before I was born and well before y'all were born. And the reason it's been there is because it's needed to fill the void of the number of doctors that are needed in the U.S. and Canada, and they're accredited, and there's direct pathways back into our countries. So for me, I went to University of Texas. I went to a big state school, and then from there I went on to do my medical school at Ross University School of Medicine, coincidentally in the very same campus that ACSOM is located. And that story I'll save for another day. But after that, I went on and did my residency, and I did a general surgery internship at Beth Israel Albert Einstein School of Medicine in New York City. And I did a radiology residency, and I graduated from the University of Texas radiology residency, and then very fortunate to do a fellowship in interventional radiology, and that was at Cleveland Clinic, which is like a world-renowned place. With that being said, this all started because I made the decision to go to a Caribbean med school. Now, I went through this process and I learned from it. I've been in the same footsteps that you all are considering right now, in the same shoes. And I've been through the process, and we are very different than every other Caribbean school. Starting off with the way that we're formed, we're a nonprofit medical school. No one's doing this to put dollars in my pockets, other people's pockets, and things like that. You are run by an independent board of trustees, and the tuition you pay goes back to improve the quality of your education. So that is the basis of structural differences between these other schools that are owned by private equity firms and New York Stock Exchange companies. And that's important because we have a social mission of producing high quality doctors for Canada and America. In addition to that, helping the people of Dominica. And through that, we've gotten donations and philanthropists to put together a large amount of money so you all can get scholarships and go through this very, very unique curriculum for the Caribbean, but just like the schools that you all deserve to go to in Canada, but there's just so few options. And how is that? These other campuses and other schools in the Caribbean are taught in teaching styles that are like 40 years old. Even if they're 20 years old, that's how long ago I went to medical school, and I'm much older than all of you guys. They teach in a large lecture hall. One PhD or retired MD comes down and they teach to you, and you're sitting there with maybe up to 650 other students. My class had 537 students in it, 67. That's not a way that you need to learn in modern day medicine. When I went to medical school, there was like 9 drugs for Parkinson's disease. There's like 15. That means you have to understand 15 drug-drug interactions, 15 pharmacokinetics, 15 this, that, and another. The review book that I went to med school with was this big. The one you guys have to use is like this big. So drastically different. So you have to learn differently. And the new medical schools and the newest curriculums in the US and in Canada are drastically different than learning in a big lecture hall. In fact, those are passive learning styles. We focus on active learning. So your typical day of med school, the night before, you're going to go and study all the material. You're going to be on Canvas. You're going to do questions at the end of the night on this platform that we have. Then in the morning, you're going to come to class and you're going to be taught by an expert in the field. So if the day before you're not learning basic sciences like biochemistry, genetics, pharmacology, pathology, except like that. That's not how we teach. We teach just like Johns Hopkins teach, just like Yale's teach, just like Vanderbilt, McGill, the great institutions in the world. And we teach in disease-based processes. So you'll learn 5 or 6 different diseases in, let's say, respiratory disease, cystic fibrosis being one of them, COPD, acute respiratory distress syndrome, et cetera, et cetera. In the morning, you're getting lectures by an expert in that field from possibly Yale University, the University of Wisconsin, et cetera. And then you break off into small group classrooms. You will not be in a large lecture hall, which is really, really important. You're not going to be distracted by your iPhone. You're not going to be distracted by other things. You're going to be learning actively because our doctors who teach the classes, and when I was in medical school, Ross University School of Medicine, I graduated from that school. I'm happy I graduated from there. But my pathology class was taught at one point by a veterinarian. That's not happening at our school. You're being taught by doctors who are licensed and who practice medicine. And many of them are program directors, associate program directors, chairmen of departments, head of research, things like that at various institutions. And you're going to be networking with them at the very beginning, starting and learning from these great people. So totally different, small classroom based, 10, 12 students in a classroom versus 600 students in a classroom being taught by one MD, not by possibly a veterinarian. So different. We can talk more later about clinicals and how that looks. And there's a lot of cool things happening in Canada that haven't been announced yet, but are just on the brink. So you guys may have opportunities to come back for your clinical rotations, and that'll be unlike any other school. But even regardless of that, we got great clinical rotations in the US. We have some coming up in Palm Springs, California, one affiliation that we have a contract with, the Cleveland Clinic, and that's my alma mater, and a few other places. So when that time comes, your advisors and everybody can talk to you about that. Moving on to getting a residency position, my role previous to creation of this nonprofit, I have a nonprofit that builds residencies. And I've been doing that for the last 10 years for other universities. And they consult with me, a nonprofit, and we go get federal funds and we open up these residency programs. And I've been doing that with the dean of the medical school, who was the former program director at Yale Associated Hospital in internal medicine. So we are uniquely positioned to ensure that you get the residency that you want. Listen to me again. I did not say get a residency. I said get the residency that you want and that you deserve. The only reason that you are not going to a Canadian university is because there's just simply not enough spots. Has nothing to do with your ability to get into the medical school. The American Association of Medical Colleges says 80% of the people that decide and apply to medical schools are qualified to go to medical schools. There's just simply not enough spots. So you will get the residency that you want, and we can talk about that later after your application if you applied, and when we can dive into all those different pieces and the different experts, and you can be part of our webinar series called Mindset to MD, of which in 2 weeks we're holding a bunch of program directors coming in and talking. Next piece is that we talk about finances, really, really important. Student loan rates are much higher than they were when I was in medical school. The school does everything we can to keep your debt out of medical school as low as possible because you don't want to end up like me. I had nearly $500,000 of student loan debt. That is equivalent to many of the other medical students that go to these big schools, Ross University, St. George's University, American University Caribbean, et cetera, you name them. Those schools are for profit and they get income because they put people to pay tuition. We're a nonprofit, and our singular goal is to make you a great doctor. Patient care is the most important thing that you're going to do, and we want you to be great at it. So we keep our tuition reasonable and low, and for Canadians, we have special scholarships because we know that the Canadian dollar is not equivalent to the US dollar, so we try to incentivize and actually help you guys do that. And there's all the banks in Canada have pretty much approved our school for student financial aid, but if those don't qualify because they have very strict requirements, our university also has a loan program for you. And we try to keep that cost as low as possible, and that's by matching the federal government rates in regards to the Graduate Plus program in the US, and also keeping our tuition down. Those schools that I mentioned before, the tuitions can $76,000 a year, some of them, and they have another $15,000 a year in fees. That means it's like $120,000 in Canadian for you guys. They give scholarships and things like that, but make the right financial decision, make the right educational decision. Know that this is a proven pathway that you can go to med school in. And I promise you, if you put your mind to it, you're going to achieve what you want to get. You're going to get the residency that you want. You're going to be proud of your profession, and you'll be in the most respected profession, making an income that's respectable also, and helping a lot of people. There's no better time than now to become a doctor and seize this opportunity. And I'm happy to be able to help you get there, and so are the people that are involved in here. On our board of trustees are some great people from Canada and also involved with our university. Dr. Andrew Patmos is one of the board of trustee members. He's the former CEO of the Royal College of Physicians and Surgeons. Dr. Karim Kayumi is a current member of the Royal College of Physicians and Surgeons, a cardiothoracic surgeon out in British Columbia. And you may have met Sandra and everybody else part of the team. And there's so many doctors here that want to see you get success. So thank you all for your time. I won't keep you any longer. And I'm sure that you guys are in good hands with the rest of the team here.
Thank you, Dr. Bagapore. I really appreciate your lens. Thank you so much for joining.
My pleasure. Bye.
Bye. Okay, great. So we do have a few questions specific to kind of the pathway back to Canada. Sandra, I thought you would be the expert. So Samar would like to know, let's see if I can. Samar would like to know, what would ACSOM offer as support for a Canadian student at our school to make them competitive as an IMG wanting to match back in a competitive place such as Ontario?
Well, first of all, our curriculum itself, being taught by physicians, having early clinical exposure will all enhance your application. It enhances you as a potential physician when it comes to your clinical exams from the Medical Council of Canada. I think getting a clerkship in Canada is probably going to be the biggest game changer ever in terms of assisting you in getting into a residency in Canada on so many levels. First of all, being immersed in the Canadian system, there are differences with the US system, and some of those differences are part of the exam structure for Canada. So being immersed in the Canadian clinical setting will definitely do that. But more importantly, well, not more importantly, but also importantly, when you're on Dominica, there will be research opportunities, basic research, or perhaps if you already have basic research skills, you may be able to participate in the Masters in Public Health that you can identify wanting to be part of. But even if you don't want to go as far as enrolling in the Masters in Public Health, you can also be a participant in some of the activities that are happening with our Indigenous work in Dominica. That will definitely enhance your CV when you are applying back into the Canadian system, because as you know, that's a very important part of our healthcare delivery models, is the cross-cultural, cultural diversity. So I think that ACSOM prepares you in a way that actually many of the international schools that you might choose do not have those advantages. The fact that we are integrated into the healthcare system in Dominica, that's also very unique in the Caribbean, by the way. Most of the Caribbean schools sit as a silo in the country that they're on, and they don't actually interact with the healthcare system. And one of the amazing negotiations when we first just took over the campus in Dominica was that integration into the healthcare systems in Dominica. And I think that itself too will aid you. We've got, sim labs that compare with anybody else's sim labs. So there isn't any aspect of the education you would experience at ASCOM that would be less than you would probably be having in a Canadian school. In addition to that, you have me as a resource. And I take that seriously, actually. I think one of the great aspects of my role is to be able to talk to students directly and answer their questions and help sort out some of the confusion, and there is confusion. Yeah. And so I am available to you, and I hope that would be one of the support systems that ACSOM can offer you. Thanks for the question.
Just in addition to that, is there any support for the MCCQE studying?
Yes, actually, the Medical Council has come up with some amazing study assist aids. And so please go onto the Medical Council site, no matter where you study, quite honestly, you need to do this. And you don't want to wait until third year when you're also cramming for many, many other things. You should be very familiar with the Medical Council website and with their study aids that they're providing. They are not there to trick you. They're there to help you prepare for the exams that are part of your career pathway. So take advantage of those aids because they do exist for your behalf.
Yeah, and one thing that I thought was I heard from a student was when all of our students were preparing for the USMLE, they were all kind of using the same practice course and book, and they were all following along. And then once Dr. Amadi, the dean, found that out, he just went, "Oh my goodness, we'll pay for it. If everyone's using this as an aid, we'll pay for it for everyone." So that's just another kind of demonstration of our commitment to making sure that our students are learning and have all the resources that they need. Another question on the Canadian rotations. Are the Canadian rotations expected to be in rural Canada only or GTA city areas too? Again, her priority is matching in Ontario, so just wondering.
Well, it's the rotations you refer to. If we do the clerkship that we're hoping to do in Canada, it would be in a hospital setting, not out in a rural small community. That will be part of your clerkship for sure. But your core rotations, we are planning on your core rotations being in hospital settings, tertiary care settings, in a community that's large enough to have that kind of hospital a resource. Whether you are doing your clerkship in the US, again, it would be those kinds of hospital settings. There is no doubt that rural placements are part of your experience as a clerk, but not for your core training.
And I think that to say that even if you did your rotation in a big city center that isn't Ontario, you would still be able to be matched or to know.
Oh, absolutely. It is. It's not relevant whether you do it in an Ontario hospital or a BC hospital or a Nova Scotian hospital. The point is that you are acquiring the skills in a Canadian context and are able, therefore, to use your references of the people, your preceptors who have worked with you. And that, we're a small country. And you will quickly find that people know the names, easy to call up and say, I've got this reference that you wrote. We're a very small country.
And it's
So whether you do it outside of the GTA or BC or Nova Scotia, it is not remote.
I also think that something that you can speak to from your experience that we know sometimes is on students' mind is even in Canada, for example, can the CARMS match see where you went to school, and does that matter when you are doing your match?
Yeah, I have had that question a few times this year. I have a lot of experience with the program directors who assess students in CARMS, and I also know the program really well. And I can tell you that one of the unique things about the Canadian system, which is possibly different than the US, I don't know for sure, is international medical graduates are assessed personally. In other words, it's not the school that we're looking at, it's the candidate we're looking at. So quite honestly, the Medical Council of Canada evaluating exam is a very high stakes exam. I'm not saying it's very hard, I'm saying it's high stakes. So it is our tool, our assessment of you and your ability to move into the Canadian healthcare system as a resident. And residents have a lot of responsibility even from day one. So that exam assesses your knowledge to be able to move into the residency on day one. So it's a high stakes exam for that reason. And most of the programs have a filter. So if you get a mark over what they consider to be the appropriate score, doesn't matter what school you went to, you are then in their pool of applicants that they will consider. So it's not like they're looking to see and look what school you went to. They're looking to see what are your marks as an individual through the assessments that you've been through.
I think
Now,
that's a great.
it's a new school. We know it's a new school. It's a new school, but it's based on modern principles. And new can actually be an advantage, not a disadvantage. We are not still back in the glory days of the 70s when most of these schools were set up with a curriculum that is perhaps reflective of that time. We are a school that has taken advantage of the most up-to-date modern medical education techniques. And that's what we are using to teach you. Our faculty have all gone through very high quality faculty training. It's a 6-month training program so that they have they have an understanding, a deep understanding of assessment of modern medical education and standards.
I think that's great. Okay, well, if there's not any other questions in the chat, what I'm going to do is I'm going to put my contact information in the chat as well. So if you have any questions, if you wake up in the middle of the night and you're like, oh, I forgot to ask a question, you can absolutely email me at any time, and I can put my phone number in there as well for you to, if you want to call or text. I'll put my.
I might even be awake.
Yeah. Another question actually was what research opportunities look like at ACSOM?
Well, as I said, because we have a Master's of Public Health in ACSOM, that's the foundation for our students being exposed to research from day one, if you choose. Not everyone wants to do a heavy research. Everyone should have the basics of research because there isn't any career path you can choose in medicine that doesn't have a requirement that you know how to assess publications and do basic studies. So that is going to be a part of your exposure. But you can, if your individual interest is higher than that, you can also have a mentor at the school that'll help you to define a project that you could do while you're in Dominica to begin your research studies.
We also have the opportunity to, you can publish your case reports. So if you have 1-page or 2-page case reports, you'll be the first or second author on those, and that's another way to kind of fill up your CV for your residency for your COMS application. So lots of ways to kind of get engaged that way. Masters would yes. So the master's, the way the Masters of Public Health works is you do 1 year of your medical education at ACSOM, and then you do 1 year of your Masters of Public Health actually at Brock University. It's offered virtually as well. So that's a partnership that we have with an Ontario university is you do 1 year with us, then you do your Masters of Public Health, and then you come back to Dominica in what is your 3rd year of study, but your 2nd year of medical education. You complete your medical education, and then you would go into your clerkships. So what that does is it gives you an MD and a Master's of Public Health in 5 years and really creates a well-rounded physician in all areas of both medical education, public health, how the two communicate and work together. And it's great if you want to work in, policy, or even just have a deeper understanding of some of those social determinants of health that we were chatting about earlier. So that's a personal option, but it is a great way to kind of get that research experience if you want to strengthen your application, or if you just have that personal knowledge that you'd like to learn more about, or if that's a field that you want to work in eventually. So it's a great marriage between two degrees. And I think from Sandra and I, to just kind of put a bow, if there aren't any more questions, I think it's really important that you do the research, that you attend the webinars, that you ask the questions, because this is a large decision. And we just want to make sure that you have the right fit for you and your medical education and what that looks like. We believe that we are the most outstanding alternative to a Canadian medical education, but it's what's right for you. And these pathways exist for all Canadians who study abroad, but not everyone has a Sandra in their corner or a Dr. Padnos in their corner, or folks that are having these conversations with the governments and with higher powers in the country to change the way your pathway home would to make it easier. So I think it's just about finding the right fit for you, but also, asking those questions and continuing to do the research so that you have all the information that you need to make a well-informed decision. Any closing thoughts, Sandra?
No, as I say, I will wake up in the night to see if I get any questions from the audience, or maybe I won't. But I am available. I just want you to know that as students, whether you're going to come to ACSOM or not, I'll answer your questions.
And another great resource we have are our students. So if you
Yes.
would like to chat with a current medical student at ACSOM, we have a really wonderful student ambassador program where we connect you directly with the students. We don't have anything to do with it. You can chat candidly. Sometimes they tell you, the best house to live in. Sometimes they tell you where the best place to get a kosher meal is. So if whatever you need, please, you can email me and I can send you the link to our student ambassadors. They're a great resource as well. So on that, I think my email got buried. So I'm just going to put it one more time in the chat for folks. And I really look forward to hearing from you, and best of luck on everyone's journey to hopefully becoming a physician in Canada.
Thank you. Good night, everyone.
Thank you. Bye.